From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus News Brief for Monday, April 12th. I'm Mark Boyle. Thousands of hospital workers across North Carolina who are charged with the care of patients have declined to get the COVID-19 vaccination, even as eligibility has opened up to the entire state. The North Carolina Watchdog Reporting Network surveyed about 100 hospitals to find out what the uptick is all about. WRAL's data journalist Ingersoll shares those results.
Across the state, more than 3 million people have received at least one vaccine dose, over 31% of North Carolina's population. Still, vaccine hesitancy remains because of trust, efficacy, and safety. Already, top state officials say North Carolina is reaching a tipping point.
We're pretty quickly going to reach the point where supply will exceed demand, and we're all going to have to flip it over to make sure that we are encouraging people to get vaccinated.
That includes healthcare workers. In the state, an estimated 450,000 people work in healthcare. To find out how many of them have decided to get vaccinated, WRAL and our partners at the North Carolina Watchdog Reporting Network reached out to every healthcare system in the state. We heard back from a little over half of them. Overall, the uptake rates among staff members range from 40% at Martin General on the low end to 75% here at Wake Med. Now, most of the hospitals fell in the 50 to 65% range. The results from our statewide survey surprised some healthcare leaders.
I thought it would have been much higher than that.
And the rates vary widely, even within hospital systems. At UNC Health, the rate for direct clinical workers is 80%. But when you look at all of the staff, it drops down to 60%.
We still have people who just recently have become eligible through our system because they weren't at risk. They were young, they were working remotely, they weren't in patient care areas.
The numbers further feed concerns that vaccine hesitancy may ultimately keep not just hospital staff, but the population at large from taking the shot and reaching herd immunity, which medical experts say can happen when at least 60% of people are vaccinated.
Once we get, enough people vaccinated where most people are immune, we're going to be able to kind of open up and free things up.
In Raleigh, Ingersoll, WRAL News.
Allie and our partners in the Watchdog Network learned about the efforts to educate frontline workers. You can read about those and learn more about the statewide rates in the story on our website, WRAL.com. Thank you for listening, and a little plug. You can listen to complete WRAL newscasts in podcast form. Subscribe to WRAL News Daily wherever you listen to podcasts. We post 5 newscasts each weekday and 2 on the weekends. You'll get all the news, weather, and sports you'd get on television, but in audio form. Just search WRAL News Daily. For the Coronavirus News Brief, I'm Mark Boyle.